President Duterte signed the Philippine Mental Health Law last June. How does this law change the game at a time when mental health awareness has increased? I am Philip Hernandez, and welcome to the pilot episode of Above the Fold. Two prominent Tamasian mental health advocates who actively supported the passage of this law are with us today. First is the founder and national chairperson of the Youth for Mental Health Coalition, Dr. Naguit.
Hello, sir.
Our second guest is a faculty member of the Department of Psychology and chief psychologist of Argao Center for Psychological Services, Mr. Renz Argao. Gentlemen, thank you for accepting our invitation and welcome to Above the Fold.
Thank you, sir.
So it's hashtag help is here. And can you walk us through a brief history of how we actually got to this point that the mental health law was already signed?
Actually, we started 2 years ago and we founded the Youth for Mental Health Coalition here in the university. So after gathering several advocates, we discussed on how we can craft better policies for the mental health law. So after that, we founded the Youth for Mental Health Coalition, and then we lobbied in the Senate. So we worked with various advocacy groups as well as professional organizations. And until now, we're still working with them for the implementing rules and regulations.
All right. So may I ask, if we only started the campaign in 2016, were there other efforts to legislate even in the past already? Were there already efforts towards this?
Actually, the campaign for mental health law started as early as the 1980s. However, several factors, legislative agenda, political climate of the Philippines actually affected the passage of the law. So it was actually only in recent years, starting in 2016, that it actually gained traction, and the lobbying for the mental health law became louder actually in Congress.
All right. So how did we treat illnesses in the past? I mean, in the absence of a mental health law that covers the entire country, how were illnesses treated, if at all treated?
Okay. Before the law, actually, the mental health services are really just incorporated in a few public hospitals. There are a few public institutions that had psychiatric ward, which caters to mental health facilities. The government was running quite a few number of mental health institutions, the most prominent of which is the National Center for Mental Health in Mandaluyong, and then it has branch hospitals like in Bataan and other regions in the country. And then for the other services, they were more of going or seeking help from the private practitioners.
All right. So can we say that, or is it true that there's a stigma or a culture that is not very welcoming in terms of mental health illnesses? Is that a fair accusation about the Philippines? Doc RJ.
I think there have been, it's actually very culturally based also, because even before we had several instances where they thought that mental health conditions are caused by evil spirits possessing people. So we already had a long way to go when it comes to decreasing the stigma, and I think that's where the different advocacy groups come in. So but of course, there is still a lot to be done in terms of integrating the concepts of mental health and really reducing the stigma.
So, just jumping off from what RJ was mentioning, so there were instances when mental health illnesses, even though they were obvious, were kept secret? They were kept under the wraps?
There are actually a lot of cases that are being hid from public because, again, connected with the stigma. In early years, actually, like what RJ mentioned, mental health is seen as an effect of demonic possession, for example, or if you're a sinner, that means the punishment for you is having mental illness. And it has been also used for political persecution. So being labeled as crazy or insane was used by some governments to actually discredit people. So this created that stigma that we still have up until today. That's why for Filipinos, for example, when you call someone baliw, that creates a negative connotation, and that people starts to fear the person, or sometimes if they don't fear the person, it becomes a form of humiliation.
So, is there anything special about the timing? I mean, why now? After 2 to 3 decades, why now? Why in 2016? Why in this, it's not even a millennial generation, the Gen Z generation now. So, why now? Doc RJ?
I think it's because of the different advocates that have come forward. Right now, we have various celebrities who have shared their stories about mental health. And it's not actually just the celebrities, but also the common people who share their stories online. In our advocacy, we actually found social media very helpful because this allowed us to have a platform where we can share and talk about mental health conditions in a non-stigmatizing manner. And I think the generation now is more welcoming when it comes to discussing these things.
Just to add, I think really one important factor that helped in the passage of the bill really is the work that the youth advocates did. The contribution is really big from the youth because the noise on social media actually helped bring the concept and the idea of mental health to the general public. So I think that's one of the main things, like the use of social media, the voice of the youth really helped.
All right. So when we go back after the break, we'll discuss in greater detail the salient provisions of the mental health law. Above the Fold, we'll be back. Welcome back to Above the Fold. So now we continue the discussion and we look at the salient provisions of the mental health law. So how is mental health defined in the law and what's the scope when you say mental health, RJ?
Well, when we talk about mental health, and as also defined in the mental health law, it actually spans not only the psychiatric conditions, because usually when we talk about mental health, the usual topics that get discussed are suicide, depression, anxiety. But here, we also talk about developmental disorders, such as children with autism, children with learning disabilities, and even the neurologic disorders, such as epilepsy and Alzheimer's disease.
All right. So it's not just the usual cases that we have or that we know of that get popular, but it also has it has a wider scope that covers these things. How about well-being? So I mean, we discussed earlier about possible disorders, possible handicaps that people had, but what about well-being?
Well, the law actually defines mental health as a general state of well-being. So that includes our own wellness in terms of our emotions, the way that we think, and the way that we behave and relate with other people. So the law, although it provides, of course, services for people already suffering from mental health problems, would also have provisions that ensures the prevention of mental illness at the same time to the promotion of general mental health and well-being.
So it's not just curing someone who's already suffering from an illness or a disorder, but also coming up with it, or perhaps orchestrating an environment that will not lead to that. Okay. So in terms of the provisions of the law, what forms of welfare services are made available or are now required? Yes, RJ.
I think one of the biggest shifts in terms of the mental health law proposals are the shift to a more community-based care. Because right now, what we have is a very psychiatric in nature, and it's very hospital-based. Okay. So this would include services that would be provided even at the barangay level, and also creating mental health services in the tertiary, provincial, and general hospitals that we have here in the Philippines.
And then just to add, since that's focusing on the community, the provisions of the mental health law would also require having mental health services in schools as well as in workplaces. So educational institutions as well as companies would now have to come up with programs and services for their employees and students to take care of their mental health and well-being. So it's also preventive.
Preventive one. So when it becomes now a disorder or an illness, then these schools and companies will have to refer to the hospital.
One provision is that the school and the company should have services for employees and the students in terms of mental health. So, for example, for schools, they may include that in the system of having mental health professionals, apart from our guidance counselors, that could cater also to the needs of those who are already suffering from mental illness.
So before they reach the hospitalization stage, then there should be already some services that can address, at least as first responders, perhaps.
Yes, for that.
Okay. But how does the law talk about the provision, or how does the law encompass the marginalized? Those who, sometimes poverty and financial incapacity can serve as barriers for you to avail of mental health services or healthcare services in general. So how does the law now ensure that this scope, this is a national mental health policy, will now be able to reach those who don't have much in terms of finances?
Well, aside from the services at the barangay level, I think one way to also bring it down to the community level is to train the healthcare professionals there. So there are provisions in terms of training general practitioners and the barangay health workers in terms of first line problems when it comes to mental health conditions. So at the very least, they should be able to address those uncomplicated cases.
And what are these uncomplicated cases or first line or front line problems, first level problems? Renz, RJ?
That would include the first problems in the family. Those, for example, that are having conflict within their marriage. At the same time, if you have conflicts between the parents and children, those usually are leading to abuse in some cases. So at least we could already address them. And the family members or the members of the community can already seek help from their respective barangay health workers even before it develops into a full-blown condition. So since there are some degrees kasi of emotional concerns, for example, that may already affect them in their functioning. So at least before it actually develops into more severe cases, you can already address them in the community.
How do we now, well, we're going to go back a little to the cultural stigma that we have. We have, this old belief that ang problema sa bahay ay dapat sa bahay lang at wala nakakalabas. How do you think can we overcome that and actually seek help, especially at the barangay level, knowing that there's also a fear of being judged by the people who live, just near you?
That's actually part of how we are fighting the stigma and at the same time educating the community with regards to what mental health really is. Because for Filipinos, we're really family-oriented. So our problems and our concerns are usually discussed within the family. That's why in terms of the services or the individual seeking services for mental health, you have lower rates of people availing the services as compared to other countries. Where like for example, in the States, if you just feel sad or you feel some worries or anxieties, you immediately go to a psychologist. But for Filipinos, you would go to our friends, you would go to our family, and then it would be the least resort for you to go to professionals. So one thing that we're now encouraging and educating people is to actually take care of their mental health the same way that they take care of their physical health. So usually we connect the analogy into physical health, so they would have the idea that it's not something that you have to be afraid of.
I think there's also value in terms of us presenting mental health conditions as a biological disease also, because there are also several hormones in your body that when are high or low lead to behavioral manifestations. And there are also genetic factors, similar to how other non-communicable diseases are developing.
All right. So you mentioned the family earlier. In the first response, you mentioned about the family. So is it safe to say that mental health illnesses or conditions do not develop overnight?
Yes, mental health conditions actually develop for a long time. It can actually start at an early age, especially since there are also genetic factors. RJ mentioned biological factors that lead to mental illness. So they're actually similar to some physical illness like cancer, heart conditions. There are mental illnesses like depression that can be passed through genetics. So if it's in your family line, and you have history of mental illness, there's a possibility that you would also be vulnerable to one. So this is what we call a predisposing factor. So it's something that makes you vulnerable. And then, of course, it depends now on your experiences, the stress that you encounter that could trigger that particular condition. So it takes some time. And eventually, you might think that a small problem or a small stressor might not have an impact. But if you put all of this together, then eventually that could trigger the disorder.
I think this is where the complexity of the mental health problems come in, because these are actually multifactorial. Aside from the biological factors, you also have the psychological factors as well as the social factors. It's also nice because we're also able to map out several points of intervention. Like for example, we can have family counseling, we can have family schools, school policy, and other interventions that address each of these factors.
All right. So is there, well, given this context, it's not surprising to expect that there are phenomena in which the patients refuse help.
Yes.
Okay? So if we are having a national policy that promotes the well-being of everybody, how do we now address those who are refusing to seek help but are perhaps diagnosed already or are showing symptoms already of being in need of help? How do we reach out to those people who have a resistance to it?
Well, there are certain diagnoses that it's actually a symptom when they don't actually seek help. Like for example, if you have depression, you don't necessarily want to be helped at certain points. But the thing there is that I think we can really be with the person and also respect the person's choice, as long as it's not considered as an emergency. Like for example, if you have suicidal ideations already, then that's the time that you report. But if the person is not really in an emergency state, then we have to respect the person and work with the person, because some of the problems are just the small problems that we need to address.
All right.
On the part of us professionals, for example, when you talk about someone who refuses help, we don't actually force them to seek help. We always say that the best patient is someone who voluntarily seeks help. So the only way that we can, in a way, force a patient to seek help is if the person is already a threat to themselves or to other people. So if they become a danger, if their mood, their emotions, or their thoughts already endanger themselves or others, then we can forcibly, in a sense, provide treatment for them, like through the use of medication to stabilize them, or to bring them into an institution for confinement. But that's the only provision wherein we can actually we can come in and force them. But in all other cases, they really have to voluntarily agree to the services.
All right. So during our discussion, social media came out as a driving force for the campaign. When does it now become problematic? And, when you deal with someone who may be undergoing some problems, maybe showing symptoms, when will social media be the last thing that you need in order to help that person? Sir Renz.
I think one thing that we see kasi in social media is that it's a double-edged sword. It has its benefits and disadvantages. I think one part wherein social media becomes a problem now is when it becomes a tool to bully or to further the stigma connected with mental illness. So some people kasi they would start bullying someone they know showing symptoms or signs. There's this incident before in Facebook of someone suffering from Down syndrome, I think. Who was bullied for his behavior. So that's one problem that it creates, and it furthers the stigma when people start romanticizing mental illness. Like for example, there was this issue before that teenagers believe that it's a trend to be depressed. So if you're not depressed, you're not in. So I think that's one of the parts where in social media becomes a problem.
I think if you would look at the literature on social media and mental health, these are actually mixed studies. Like for example, there are some who say that it depends on how you use social media. If you use it more actively, like sharing content, commenting on other people, then it becomes helpful. But if you just use it more passively, like for example, you scroll through the feed,
just looking at other people's lives,
it becomes more negative because you tend to compare yourself with other people, especially in Instagram, because there's also research that validates that in the UK.
So it's more negative to be a lurker or a passive observer, someone who just looks. So it's better. Is it better to engage then, based on that literature?
Well, it actually still depends on the context, of course. But for us, it was also helpful if we try to engage people who are showing some symptoms on social media, because sometimes they may blurt out or they may tweet something that might be dangerous. And that's already a cry for help already, and that's a point of intervention already for us.
And at the level of parents, teenagers, teachers, what are these red flags? What are these cries for help?
If we're going to look at social media, for example, this may come into the post. Although, again, what we avoid is generalizing. So some people, because of their artistic expressions, they might really post something that looks dramatic, for example, or emotional. That's why we have to look at the trend of the behavior of the individual. If it's their usual behavior to post something about sadness, for example, because of their artistic expression, then maybe it's something that really is just something literary. But if it's something that's unusual, something that they don't normally do, then it might be a sign that there might be something going on. Especially if their posts are connected to death, about hopelessness, about not having a will to live. These are usually signs that we have to look into.
So it's not right to say, it's not right to base your judgment on a single post.
Yes.
Yeah.
Rather, you have to backtrack and check if there's any trend or any pattern.
Yes. Actually, even in actual behaviors, it's something that we have to look into apart from their behavior on social media.
Okay.
Before, for example, if someone is depressed, they usually lose appetite. But there are now cases wherein it's the opposite. You have an increase in appetite. So you cannot simply say that if a person has low appetite, they're already depressed. So you have to look at the changes in their patterns of behavior.
I
So
see.
what we suggest to parents is look for sudden changes in behavior, especially those that are already affecting functioning.
Okay. So what's the responsibility now of the professionals, healthcare professionals, schools, those who are delivering frontline services? Based on the law, what are the responsibilities that are now required of hospitals, educational institutions, companies?
Let's start with educational institutions. Schools now have to integrate in their curriculum mental health education in an
Okay.
age-appropriate way.
Okay.
So since we have to put mental health education from kinder until the tertiary level, we have to ensure that the information that we provide students is, of course, connected with what they can get, what they can learn, and what they can understand. And apart from that, of course, is to ensure that the services are made available to the students.
Okay.
So this is from prevention to intervention to postvention. At the same time, schools would now have to come up with policies in terms of accommodation. So
Okay.
how do we accommodate students with mental illness? The same way that we are accommodating students with physical disability.
I see.
I think there's also space that we talk about mental health in the workplace because
Uh-huh.
we don't usually have services there, unlike in the schools that we have guidance counselors. So if we are to create a policy, it must encompass everyone. It
Okay.
should mind the mental health of the workers, of the people in the community, and also the students themselves.
All right.
Yeah. And it also directs, of course, the different local governments units to adopt mental health programs because, as you know, health is devolved in our country. That's why it's the responsibility of the local government units to ensure that the law is actually implemented even at the barangay level.
All right. Confidentiality. How sacred or how valuable is that word in this, fight for mental health awareness, for the well-being of everybody? How important is the word confidentiality?
Actually, if you would look at the mental health law, it actually has a very lengthy discussion on the rights of people with mental health conditions. And it's actually a reaction to the dark past of psychiatry and psychology before. One of the most important points that was discussed is the right to confidentiality. Of course, we would like to, safeguard people against stigma and undue discrimination. And but of course, there are several instances when we can break confidentiality, especially what Sir Argao said earlier about if the person is already a threat to others and to themselves, as well as if there are pending legal cases that might necessitate the person to divulge his or her mental health condition.
I see. All right. So, what's the next step now that the President Duterte decided in June 20? What's the next step in the process?
Well, right now, the mental health law is already in effect,
Okay.
but we're still waiting for the implementing rules and regulations. The IRR task force have already convened and are now working on the draft, and we expect the IRR draft to be finished by November 2.
Okay.
But right now, there are several advocacy groups that are already trying to deliver services at the barangay level and also train the different doctors and other healthcare professionals.
All right. So, just to localize it a bit, of course, to UST. How was UST, in this? How is UST situated in this entire process of coming up with the mental health law and perhaps even in the IRR? Do you have colleagues with you who are ophthalmatians upbringing who are joining you in the fight?
Of course, apart from our advocates who have really lobbied for the mental health law, after the law was passed, UST was one of those who was nominated to be part of the National Mental Health Council.
Okay.
So we were one of the 3 nominees for the representative of the academe, together with Ateneo and the University of the Philippines. That we were represented then by the former director of the Career and Counseling Center, Dr. Lucila Banse, who is also working with the Department of Education and Department of Health in coming up with modules for mental health for our basic education students.
Okay.
And then Of course, in terms of curricular developments, the Department of Psychology has been also working for us here in the university. We developed a special module on understanding the self.
Okay.
This is the new general education course required for all freshmen. So a part of that, we incorporated a module on mental health, self-care, and also resilience. So it's only actually UST that has this module for students.
Okay.
And apart from that, of course, we've been offering services also for our students and for our partner community. So in the university, we have the Psychotrauma Clinic, who for about 15 years has been offering free services also to the public, from direct services in counseling and therapy to even going to communities to help those affected by calamities and disasters.
All right.
As I said earlier, the Youth for Mental Health Coalition actually started here in the university, and a lot of our members are actually coming from UST, either students or even faculty members have been very supportive. In fact, the university have also supported in terms of providing avenues for us to hold events. Like, for example, our first event was trying to integrate mental health in schools. And with that, we developed a mental health policy checklist that we forward to different schools right now. And I think the Career and Counseling Department is also doing a very good job, since it's been recognized also as one of the benchmarks of other universities in terms of bringing mental health in schools.
All right. So when we get back from the break, we'll take a look at the action points and the takeaways that we're going to have. Now that the mental health law is passed, by November we'll have the implementing rules and regulations. How do we, as the Mashan, as a part of the regular public, the general public, now act on this mental health law? We'll be back. Welcome back to Above the Fold. Now, what do we do? The mental health law is here. What do we do? What should we not do? Doc RJ, if you're dealing with someone who is symptomatic of mental health illnesses, or you're just someone who just wants to promote mental health, well-being among everybody, what are maybe 3 things that you should not do when you interact with people?
I think if the person is already in emergency state, like for example in active psychosis or in a suicidal, having suicidal ideation, then you should not leave the person alone. You should allow the person to express, and of course you should not invalidate the person's struggle, because it's very common in our culture. Like for example, if a friend is sharing a story, then you already have an opinion on it. So allow the person to verbalize. And lastly, do not let the person escalate the problem. Like for example, if there are small problems that can be resolved already, then let's do our part and try to solve those with them.
So, Doc RJ, is okay lang yan okay? Even going to that point of yours when you said don't invalidate it. When we say okay lang yan, is that actually okay?
Well, for someone who is suffering from depression and having hopelessness, these are actually words that might compound on what they're feeling, because it actually becomes a source of frustration for them. Because all we know, they're trying everything that they can to cope up with their mental health condition. And if we just say, okay lang yan, and they're already trying, then it becomes an additional stress for them.
Okay. So, on the other side of the coin, so Renz, what are the things that we should do to promote a mental health friendly environment for all?
I think the first thing that we need to do is to ensure that we know how to listen to people. Whether that is your family, your friends, your coworkers, your student, or your teacher. The first thing that we need to do is to listen. So if someone is telling you their problem or their concerns, so listen to them. Of course, that's connected with not invalidating them and not preaching to them. But simply listen. Just let them express their thoughts, their feelings. And that could already help them relieve their feelings of burden. And then after that, the second thing that we can do is to, of course, provide support. So the support can be something practical. It may be helping them with a chore, or helping them with a task in school, an assignment perhaps, or even sharing your notes with them. Or it could be information also, or information in mental health, by
Okay.
letting them know, for example, what mental health is or what mental illness is. Okay, like for example, they're suffering something from something that is normal, and their reactions, their mood, their behavior is normal, given the situation is abnormal. Because you have to emphasize that your behavior is not abnormal. It is a normal reaction to an abnormal situation.
I see.
So that's the second one, to provide the support. And then the third one, of course, very important, is to do referral. We need to, especially if we're not professionals, we need to refer them to professionals, especially if the condition is already affecting the person's functioning. So if they no longer are able to do their work or go to school, then it's important that we know how to refer them to the necessary professionals.
All right. So we both know that you guys have your own advocacies. I mean, apart from the Youth for Mental Health Coalition, in your own spheres of influence, you fight. You join the fight, continue the fight for mental health. So at this time, if you have something to say to the general public, I invite you to look at the camera. We'll go with RJ first, and then with Renz.
Well, for me, I've always been saying that the mental health advocacy is always grounded on kindness. It's always kindness to others. But I think we should also shift to saying that the kindness should also be extended to ourselves. Because sometimes in terms of advocating, we get burnt out, we get negative life experiences also. And that's something that we need to recognize. And even mental health advocates go through bad days also.
Thank you, RJ.
We always know that people who suffer from mental illness suffer alone. In the fight for mental health and the promotion of mental well-being, we really need to work all together. So it starts with each of you, especially our fellow Thomasians. The fight begins with all of us. We need to provide support for people. We need to start educating people, and we need to help fight the stigma connected to mental illness.
All right. Once again, guys, thank you for joining the pilot episode of Above the Fold. So, thank you, Doc RJ.
Thank
you,
you.
Sir Renz.
Thank you, Sir Philip.
And now, dear friends, the passage of the mental health law in the Philippines is one big step in eliminating the stigma surrounding a topic that people were once afraid to talk about. I guess it's safe to say now that open discussion about mental health will help in recognizing that it is a public concern and therefore it needs national attention. I am Philip Hernandez and this has been Above the Fold. Thank you. Thank you for joining us.